In Chapter 9, we will be discussing wounds. There are various types of wounds. One is an open wound where it breaks the skin's surface and lots of bleeding can occur. Problem is it allows bacteria to enter the body and that can cause an infection. Anytime the skin is broken, you are at risk for developing an infection. A type of wound is called an abrasion. That is just a slight top layer of skin is removed. You have very little blood loss, sometimes no blood loss, but it can be very painful. A laceration is cut with jagged or irregular edges, and it's tearing away the skin tissue. When we have a puncture, it's usually deep and narrow. There's a high risk of infection. Another type of open wound is an avulsion, or a flap of skin is torn loose. For example, a piece of the ear is loose. Amputation is a cutting or tearing off of a body part. You need to protect yourself when you're caring for open wounds, so make sure you're wearing exam gloves. You need to expose the wound and control the bleeding with direct pressure. Cleaning a wound, you need to scrub hands with soap and water. Then clean the wound with for a shallow wound, wash with soap and water, and then flush with clean water under pressure. For wounds that have a higher infection risk, you want to clean the wound and seek medical care for additional cleaning. You can use tweezers to remove embedded debris, and if bleeding restarts, apply direct pressure. When you're covering a wound, you have to prepare the dressing, apply it over the wound to control bleeding and prevent contamination. This must be sterile or as clean as possible. You can bandage up the dressing and that holds it in place, and that does not need to be sterile. If the wound is small, you can put a thin layer of antibiotic ointment and then cover with a sterile dressing. Never pull off a dressing that has become stuck, as you can tear off more skin. If you have to remove it, soak it in warm water to loosen it. Change any wet or dirty dressings. You should seek medical care for high-risk wounds, something embedded, animal bites or human bites, puncture wounds, deep wounds, any visible joint, fat, tendon, muscle, and any wound entering the joint or body cavity. Also, wounds that need sutures are best placed within 6 to 8 hours. Anyone who has not had a tetanus shot within 10 years needs to get one, and if it's a very dirty wound, if you haven't had it in the last 5 years, you need to get a tetanus shot. Your risk of infection increases with wounds that have a foreign material in them, or if there's crushed tissue, ragged tissue, injury to the underlying nerves, tendons, any type of bite wounds, hand and foot wounds, and puncture wounds. When an infection does occur, you need to look for swelling and redness around the wound, a sensation of warmth, throbbing pain, any pus that is discharged, fever, swelling, and red streaks leading from the wound toward the heart. What do you do if a wound is infected? You soak it in warm water, apply wet packs over the infected wound, add antibiotic ointment, change the dressing several times a day, take pain medication, and seek medical care if the infection persists or worsens. Tetanus is a toxin produced by bacteria. It travels to the nervous system and can cause lockjaw. There's no known antidote to this toxin, and that's why tetanus vaccine is very important, and then boosters every 10 years to prevent the disease. If you've never been immunized, you will get a tetanus shot, and if you haven't had one in 10 years, then you will get a tetanus shot. Or if the wound is very, very dirty and you haven't had the booster, they'll give you a booster if you haven't had it in 5 years. You must receive it, though, within 72 hours of the wound in order for it to be effective. Amputations and avulsions are very, very tough, and usually it's an extremity that can successfully be reattached. Avulsions, where skin is torn away, a piece of the body part is torn away, usually involve the ears, fingers, and hands. It can bleed very heavily. Different types of amputations: there's clean cut or complete, a crushing where it's like mashed and broken off, or degloving where the skin is peeled off. If you do have a patient that has an amputation, call 911, control the bleeding, treat the shock, and care for the body part. Wrap it in wet, sterile gauze, put it in a container of ice, and send it to the medical facility immediately. If it's an avulsion, you gently move the skin back to the normal position, cover it with a sterile dressing, apply pressure. If the bleeding continues, apply a tourniquet or hemostatic dressing if available. So that is the end of part 1 of this chapter. Next video will conclude with part 2 of the chapter.